The fourth annual health conference organized by the Association of Nigerian Health Journalists (ANHEJ) draws stakeholders in health to discuss on the theme COVID-19 reportage assessment to look at the roles of the media in the fight against COVID-19 and identifying various ways of presenting it to the public for easy understanding. Delivering a paper on the subjects, CEO International Society of Media in Public Health, Chief Mojima Konjola, calls on health journalists to be more in-depth in their reports and be visible in the social media.
I hope that we'll be able to use the next 48 hours to close up on a lot of gaps that we have and do more until, of course, we as health correspondents project health as mandatory, project health as an investment. Nobody is going to do that for us. So I hope that we will continue with the good work that we are doing and do much more. Much more is expected from us. You must be able to report from the point of knowledge because you are speaking to life and death.
In our goodwill message, representative of the World Health Organization (WHO), Charity Warugun, says journalists are influential in shaping attitudes and behaviors, adding that health journalists should step up in sensitization and awareness creation in the fight against COVID-19.
During Ebola, for instance, Nigerian journalists made my work a lot easier. For polio eradication, where Chief Mojo was also involved, Nigerian journalists made my job a lot easier. And I will say with huge degree of confidence and that for COVID-19, you've done very well, but I think there's a lot of room to improve on.
Earlier in his welcome address, the ANHEJ president, Hassan Zagi, said though the COVID-19 pandemic has brought about a new normal in the journalism profession, he called on his colleagues not to allow the several discouraging working conditions of the profession in Nigeria to deter them from churning accurate reportage.
In the process, journalists, especially those covering the health sector in Nigeria, were overstretched. Some even contracted the virus. By our own assessment, we did our very best within the circumstances we find ourselves by working closely with medical and health experts, health-related institutions, and critical stakeholders in the health sector to ensure that our people are well informed about the coronavirus.
Awards were presented to health reporters who were outstanding in the reporting of family planning. Joseph Kadiri of ITV emerged the best reporter TV category.
Mr. Joseph Kadiri of Independent Television. Congratulations.
Yeah, Mr. Kadiri.
You can also look at the camera, please.
While expressing joy, he dedicates it to the staff and management of ITV.
We want to say a very big thank you to Independent Television for giving me this platform, and also a very big thank you to the staff and management of Independent Television. This award is dedicated to ITV, and of course my family. This of course will show that the time we spend outside the home is actually paid. Thank you so much, Africa Health Budget Network, for this award. It really will spur me to do more.
It is hoped that this height is maintained by the winners, as the reward for hard work is more work. Charity Tanko, ITV News, Abuja.